My name is Melissa. I am part of the specialty academic team at Aspen. My official title is Academic and Industry Relations Manager. I'm still kind of not sure what that means, but basically I work with the specialists. I work with oral surgeons, endodontists, and kind of just matching them up with opportunities that we have available at Aspen. Today I have with me Seth Cowan, who's also on the specialty team at Aspen. Go ahead.
Hi, this is Seth Cowan. I've been with Aspen Dental for close to 15 years. Moved over to the specialty side in 2015. My role and my team's role is the recruitment and hiring of both oral surgeons and endodontists. Super excited to be with you today. Super excited to have Dr. Chishom with us. I think you're going to enjoy this great hour in a little bit, hour and 15 minutes, I think we have, Melissa, but it's going to be a lot of information, and I think it's going to be some great information. So thanks for having me.
Sure. And Dr. Chishom?
Hi.
Hi. So why don't you tell everybody a little about yourself? We'll start with that.
Well, welcome everybody. Thanks for taking the time to join us tonight. My name is Dr. Mark Chishom. I am an oral surgeon with Aspen. I've been with Aspen for approximately 6 years now. I trained at the Medical University of South Carolina, both dental school and for my oral surgery residency. After my oral surgery residency, I was in the Army for 3 years where I practiced as an oral surgeon due to dental school commitment, the health profession scholarship. Some of you may know about that. And after that, I was in private practice for approximately 13 years in South Carolina. And we decided to make a move from a small city in South Carolina to the big city of Atlanta, at which time I joined Aspen over trying to start a private practice here in Atlanta. And I've been with them ever since. So as you can see, I've pretty much practiced all the aspects of oral surgery except for teaching. So I've been in the military, done private practice for a while, and also doing the DSO. So I can kind of compare and contrast what's available to the oral surgeon now and kind of what you can expect from any of those modalities. So I've got 3 kids. One's training on plastic surgery in Richmond at MCV. So if any of you are up there, please go by and tell her hello and help her with mandible fractures. I've got a middle daughter who's getting ready to go to medical school. And my son wants to go to medical school. He's a sophomore at UGA. Nobody wants to do dentistry. That's where he goes.
That's okay. You're still a proud dad, right? It's a lot to be proud of.
Very proud.
Good for you. So just so everyone knows, if I'm looking away from the camera, I have everybody's questions here. So it's kind of like mission control over here. I have to switch gears back and forth. So we'll jump into some of the questions that came in as the folks were registering. And again, I tried to put them in some kind of an order, but if we have to jump, out of order as questions come in, that's fine too. So in no particular order, the first question, and this is kind of a good one to start with. How did your colleagues perceive your decision to pursue corporate dentistry over a more traditional private practice or hospital environment?
That is a great question. And let me give you a little background about that. I was the state board examiner for oral surgery in South Carolina years ago. And as DSOs were just getting going, I swore that I would do all that I could to prevent DSOs from entering the state of South Carolina. I didn't know enough, nor did I support that modality of practice. So there was a stigma that a lot of us had, and some people still do, about the practice of corporate dentistry. So when I first got started, those of my colleagues who knew me well were quite surprised that I would join a DSO to practice. And I get a lot of questions about this. And since that time, I've had a lot of folks be very surprised that I'm so positive about it, or that I've had a good experience involving my time with the DSO. So initially, it wasn't positively accepted because so many people knew me and knew what I was all about. But you'd be very surprised at how many people now are very interested in what I'm doing and have responded very positively about it.
Great. So kind of along the same lines, one of our viewers wants to know, is there a competitive hierarchy among the Aspen oral surgeons that would place an added stress on new providers to produce?
There is no system like that. All of the Aspen oral surgeons are very friendly. We communicate a lot, especially in the states around you, or if there's more than one oral surgeon in the state that you're practicing. There's a lot of communication. We share a lot of cases. There's no competition. You're not pressed to do that. So that environment is not really fostered. That's not what Aspen is going with. It's sorry about my son going by in the background.
That's okay.
It's not like that at all. As a matter of fact, I found it to be a very helpful environment. Most guys want to see that you do well, not only with your practices, but within Aspen. So it's been great from that standpoint. No competition whatsoever.
Great. So you've been with Aspen for a while. So think back. We have a viewer that wants to know what your interview process was like with Aspen, and also how did you manage the job searching process while you were still in residency, and how did you know you were ready to make a decision? So kind of a few questions thrown together in there.
Sure, that's a great question. When I decided, I was actually considering one of 3 positions when I was trying to decide what to do. The other 2 positions that I was looking at were both private practice, one to join a group and another to buy a practice and Aspen. So I ended up interviewing with Aspen, and I'm sure we're going to get to this, but I had a lot of concerns about practicing in this type of environment. I wanted to be insured, especially given my age and experience. I wanted to make sure I had some autonomy. I also wanted to make sure that the potential to keep my income at a level where I was already used to it being was there. A lot of questions like that, a lot of concerns that I had like that. And Aspen was very forthcoming, very straightforward. There wasn't anything hidden from me. And unlike my situation, you guys have the advantage of being able to talk to me during this discovery process. This wasn't available, or Aspen had not started this when I was coming on board. So this is an incredible opportunity for you. I was able to speak to 1 or 2 of the oral surgeons that I kind of called off the cuff, who gave me some information about their day-to-day lives and what they were experiencing with Aspen. And I was able to make more of an informed position or decision. Melissa, what was the other question involved in this? I'm sorry, because I could go
that's
on
okay.
for a minute.
That's fine. Just what was the interview process like with Aspen? And also, I know you didn't come right to Aspen out of residency, but if you can think back to when you were in residency and when you were going into your first position, how did you kind of manage completing your residency, also looking for opportunities at the same time?
Well, because I came out of residency and went into the Army, I didn't go through the normal process that a lot of you residents are going through as far as interviewing and all that. But while I was in private practice, I had the opportunity to hire residents coming straight out of residency. And I know the process from a practice owner standpoint of how we were thinking and what a resident's thinking and what he's wanting. And let me say this first. To all of you guys coming out of residency, you're coming out with these preconceived notions of what private practice is like and what you're going to hopefully do in private practice. And, you know, you're tired of being told what to do for, you know, ostensibly 4 or 6 years, and you're ready to get going. But believe it or not, it's the things that you didn't learn in residency that is going to frustrate you the most when you get out. You really haven't learned how to manage employees. You really hadn't learned how to manage a budget. You really haven't learned how to run an office. You really haven't learned very well how to deal with referring doctors and how you integrate into the dental community as an oral surgeon. One of the hardest lessons for me to learn is coming out of residency and you know, while you're still training, oral surgeons are kind of at the top of the totem pole as far as dentistry goes, and you come out with this chip on your shoulder because you've done all these fantastic things that, you know, most folks in dentistry don't see or do because of our medical exposure. But I got news for you. When you get out of residency and get into the private practice world or whatever other modality that you decide to work in, you're not at the top of the totem pole. You're at the bottom of the totem pole, and you live and die based on the generosity of those who choose to refer to you. So let me say to you, regardless of what you decide to do, humility is the first lesson that you need to learn coming out of residency. Those guys who are most successful as post-residents early in their career are those who learn very early that humility is the best characteristic that you can have as a young oral surgeon, and realizing that your colleagues are the ones who feed you. And that is a lesson some people don't get for a long time. But that is one of the things that you should consider coming out. And another thing is too, refining your skills and being in an environment that can allow you to learn how to treat patients on your own. It's pretty scary when that attending is not standing in the next room or standing right there by the bed or the chair with you when you first get started. And the one thing I could say about Aspen, although I didn't have that issue, is that you have the autonomy to work at your pace. It's your schedule, it's your practice. And another nice thing is the general practice dentists are motivated, not only financially, but from a colleague standpoint, to refer to you. So you have a captive audience, and that's kind of nice as compared to the guys in private practice.
So we're kind of jumping around a little bit, but so many things that you just said are perfect segues into a lot of these other questions that I have here. So you mentioned about referrals. So a few questions came in about where do your patients come from? Are they referred from internally from Aspen? Do you get referrals from outside of the Aspen network as well? Can you talk a little bit about that?
Absolutely. Yes, you do get outside referrals. I don't foster that because I'm actually busy enough with my internal referrals from the doctors I work with Aspen that it's not a need for me. But because you are on the insurance rolls, a lot of patients will go and kind of, look at their benefit structure and see who's in their network. And a lot of times the Aspen oral surgeon is part of that network. So I find myself doing a lot of third molars from outside doctors and orthodontists, a lot of orthodontic extractions, a lot of just similar things that I saw in private practice. I see with Aspen, both from internally and externally. Obviously, internal referrals compromises probably 75% of my practice. About 25% of my practice I do see. As a matter of fact, I did 3 kids today for orthodontic extractions prior to being banded. So that's my mix, 75-25. Some guys a little more, some guys are a little less. It depends on the part of the country you're in.
Okay, great. Actually, someone asked, do you see children? And I guess the answer is yes, you do.
Yes, a lot of, probably 50% of my private practice were 16 and below all the way down. I treated kids all the way down to like 4 or 5 years old. Maybe because I had a comfort level there, maybe because my wife's a pediatrician, I don't know. but I treated a lot in private practice, and I valued that. I do see some children with Aspen. Obviously, that's not Aspen's main focus. That's not who we particularly cater to. But again, because of outside referral, and then if you establish a reputation that you treat those kind of patients, you know, I have doctors from the outside that like to refer to me, pediatrics to me, because I still do enjoy doing that. Not a lot of guys have a comfort level with that, nor do they want the headache of hearing all the screaming and yelling, you know what I mean?
That's probably why they asked the question.
That's right, that's right. So it's kind of, again, you're kind of in control of that. If you want to push that as something you want to do, then go for it. Go out there and market yourself for that. Aspen welcomes outside referrals and only bills the network. But if it's not something that you're interested in, you don't have to foster that either, because most of Aspen's work is pre-prosthetic surgeries, extractions, and implants. But I still do a fair amount of orthodontic type, you know, oral surgery, orthodontic type procedures. And before you even ask, I do not have hospital privileges. I did trauma for years and years and years, but because oral surgeons in Aspen travel from an itinerant basis, I cannot, you know, be on a trauma schedule or anything like that. If I have cases that I feel like are better treated in a surgical center or in a hospital setting due to the patient's comorbid factors, I will refer those patients to outside oral surgeons that I know in my area or in the city that I'm practicing for them to take care of.
Doc, you are so thorough. As you're talking, I'm sitting here, I'm looking at the questions, and you're just like checking off all the boxes, which is great. But just to kind of elaborate, because these were questions that were asked. So you mentioned about taking insurance, and that's sometimes how you get your outside referrals, because they see that you participate in the insurance. So one of the questions is, do we take insurance? Obviously, yes, we do. And, you know, what types of insurance? Do we see Medicaid? Do we see Medicare?
Okay, I think, and forgive me for this bias, and you can call me or email me later and yell at me, that's fine. But I think one of the best parts of this practice is that I do not have to take Medicaid fees. And forgive me for being so passionate about that, because in private practice, I had to eat pennies on the dollar treating Medicaid. And Aspen does not accept Medicaid. And from a financial standpoint, that is definitely a bonus. That was one of the first questions I asked in my interview, because, you know, for you guys that don't know, it basically takes 3 patients in Medicaid to equal 1 fee. I mean, and you work your butt off for not as much compensation. It's tough. That doesn't mean they don't deserve good care too. They do. But after years and years of treating that population and working so hard for that, it was a welcome thing for me. Now, let me also say this. One of the advantages of working for Aspen, well, let's back up. Let's say, for example, as a resident, you decided to go buy a practice, or you decided to go start a practice. What happens is insurance is more than willing to allow you to come into their network, but what happens is you get the worst fees because you are the new kid on the block. And if you go to a big place like Atlanta or some of the other big cities, there are already so many oral surgeons on the roster, on the roll, that they don't care about offering you terrible reimbursements. And so you have to literally practice for a long time and kind of climb the scale before you get to a point where your fees are at least reasonable. One of the nice things about Aspen is they have a whole division that is dedicated to doing nothing but negotiating your insurance fees for you. Aspen has a vested interest in making sure that your fees are as good as they can make them. That benefits everybody. So that's another thing that I don't have to worry about, that I constantly dealt with in private practice, is negotiating with insurance companies to get better reimbursement rates. Aspen's a big boy on the block. They're big. All the insurance companies know who they are, and they command a lot more status than you can from a private practice standpoint. So from the day that I started, I was kind of amazed at some of the fees that I was able to get through Aspen. And then I also noticed that, or what I can do is, if I ever notice that a fee is dropping or it's changed or it's not as high from a new patient, I'll just call corporate or call Aspen insurance division and say, hey, look, you guys need to renegotiate this rate. It's way too low as compared to what I know it could be or should be. And then they take over from there, which is a very nice thing. Once again, it's one thing you don't have to worry about.
Sure. So kind of switching gears to, since we're talking about insurance, a few questions actually are coming in about malpractice insurance. So the questions are, does Aspen help with malpractice insurance? And the second part of that question is, someone was, heard from someone that if you work with Aspen, your premiums go up. So can you speak to that?
No, my premiums did not change. I'm with Omsnick. For those of you who don't know, Omsnick is the malpractice group that represents only oral surgeons. It's oral surgery owned and only covers oral surgeons. I was allowed to choose what malpractice insurance I wanted, and per your negotiations with the company, they will reimburse you for a percentage of your malpractice. So yes, Aspen does help with my malpractice insurance. And I was able to choose the one that I wanted. And no, my premiums didn't go up because I was with the DSO. Matter of fact, it didn't change from private practice to starting with Aspen. It stayed the same.
Cool. And everyone who's out there listening, I appreciate your participation so much. These questions are literally coming in faster than I can read them. So thank you guys. I am going to try my best to get through as much as we can. If we don't get to your question, we definitely will follow up with you after. So forgive me for kind of like rushing through this a little bit, but questions coming in. What overhead do the oral surgeons have to pay for at Aspen?
Good. That's a really good question. There is another very nice thing about Aspen is, and once again, I don't want to get too much into that because obviously it's been 6 years since I joined the company. And so, things change, but Aspen either shares or covers a lot of your overhead. It depends on the structure of your contract and where you are and that kind of thing. But the only things I have to cover as far as my overhead goes are licensing fees. And I'm able to get those deducted from my payroll pre-tax, which is a definite advantage, kind of similar to private practice. So I pay my DEA fees. I pay for my state licenses. Other than that, all the other overhead let me make this a little bit clearer. So as far as the day-to-day practice, a lot of your perishables you pay a percentage of, and Aspen shares a percentage of. As far as your employees, you will hire and you will be in control of that. You have the say as far as your assistants go. You will actually help participate in the interview process. I actually wanted more assistants. I have 3, and that's probably more than most guys do, but this was a private practice carryover for me because I want to make sure. Georgia has a state law that says at least 2 assistants have to be in the room at all times during a sedation or during the administration of anesthesia. So I never want to be out or not be able to do what I need to do because of assistant calling out or not being available. So I have 3. If one goes down, I still have 2 assistants. If they're all there, I can move very quickly. I can have 1 in one room preparing the next patient, 2 with me, and I can just see a higher volume of patients because I can get a quicker turnover. Aspen, so to get back to the compensation part, because that's going to be different for everybody, I chose 3. Some people choose just 2, and in some places that don't have any rules, some guys only have 1. So Aspen pays for part of their salary, I pay for part of their salary. And there are other structured fees that we split. I'm not looking at my my statement right now, but for the most part, I can't think of anything that they don't share with you. So the overhead is there, just like that is private practice, but I feel like from a perishable standpoint and from an employee standpoint, my overhead actually went down from private practice to Aspen.
Yep, I mean, and that makes sense, right? Because obviously being in such a large network and we have a lot more buying power. Actually, funny side note, we are Henry Schein's biggest customer outside of the US government. So obviously we—
Economy of scale. Without getting specific about it, it's economy of scale.
Yep.
Aspen negotiates special rates and prices with all the vendors. And so my overhead is cheaper. I can buy things, whether it be gauze, burrs, scalpel blades, whatever it may be, I'm paying a lot less with Aspen, which I'm splitting with them, than I did in private practice. Before we came on air, I was talking with Melissa about the fact that one of my private practice buddies is complaining about the fact that KN95 masks now are running $3 to $4 a piece. That really runs up your overhead per case. And so they're either eating it or passing it along to the patients, but either way, their overhead's going up because of COVID. For me, every day that I walk into the office, I have not bought any mask. I have not bought any PPE. I'm actually being provided with shoe coverings, full gowns, head coverings, KN95 masks. The only thing I bought was a special shield that I can kind of flip up and use during surgery. So from that standpoint, it's been very nice because my buddies in private practice are just really bending underneath the weight of all of the costs of the new PPE necessary for us to practice.
Sure. And again, kind of jumping around a little bit, but just because everything that you're saying is like kind of coinciding with these other questions that I have here. Of course, the COVID question came up quite a few times. There were a few people that asked about just how had the offices changed now that they're reopened during this COVID pandemic. Are you seeing less patients? If you can kind of just give us a little overview on how the offices are handling it.
Sure. Aspen has really been at the forefront of protecting the patients and the doctors. They have actually put the whole company through special safety training and put in guidelines to help us run our practices more safely and efficiently in the face of COVID. How has it changed? Initially, when we first came out of quarantine, I wasn't seeing as many patients because I wanted to get a safety flow and treat patients in a more safe manner so that I didn't feel like I was rushing and my assistants were following proper safety protocols. So initially we crawled, but now I'm probably back up to about 85 to 90% of what I was doing before COVID, because we are now used to and have established a routine that I feel is safe, which allows me to go almost up to full speed. Now, Aspen, just like any private practice, most private practices are doing this, limits the flow of patients through the offices. For example, my escorts or chaperones aren't allowed to come into the building. My patients don't come into the building. They sit in the car in the parking lot until my assistants go to get them. And then we bring everybody who's of a consentable age back to the operatory, and then we get started. If they have a chaperone, then or if they're not of consentable age, we bring the parent or the guardian with the patient. And as soon as we're done, we discharge them back to the car. We don't let them sit in the waiting room. We're taking all the same precautions that you're probably doing in your resident clinics or your private practices, or other guys are doing in their private practices now. So I'm almost back up to flow. I'll probably kind of stay where I am right now, which means I'm not seeing as many patients as quickly as I did prior to COVID, but it's a safety issue I feel for myself and my staff and for my patients.
Do you feel safe at work?
Oh my God. Yeah, as safe as you can feel right now. Obviously, we're at ground zero with this. The only other specialty I know of that could have more of a risk than what we're doing is ENT and anesthesiology. You know, but we take all the precautions that we possibly can. Face mask, KN95s, which are being provided for us, shields, full gowns, shoe covers, head covers. You know, the safety factor has nothing to do with Aspen or private practice. It's just the environment that we're having to practice in now. It's not easy for any of us, but as safe as I can be, as compared to the colleagues that I know in private practice, I may be doing a little bit more from a safety standpoint.
And you mentioned anesthesia. We have a question coming in. How do you manage anesthesia med orders at all of the offices that you cover? Do you have a safe at all sites?
I'm sorry. Yes. Okay. Your state has guidelines that you have to follow. The DEA has guidelines that you have to follow. I follow all those guidelines. I have a Criticare machine in every office. I have a wall-mounted double lock safe in every office where the drugs are kept. I have emergency battery operated suction. Everything that the state of Georgia mandates that I have to have in order to practice anesthesia safely, I have in every office. Aspen does not cut corners where that's concerned. If you state that this is what we have to do in order to practice in the state, that's what they purchase and have available for you. And I have never gotten any pushback from that. They have been extraordinarily cooperative and easy to deal with. When you start up at a new office, there is a kind of a startup list of equipment that they provide for you. Drugs, instrument trays, hand pieces, all of the safety equipment that you need for anesthesia, even I think I did say drugs. So there's a lot of stuff that you don't even have to pay for. Perishables, you know, gauze, burrs, stuff like that, day-to-day stuff you do. But they're really good about providing most of that for you when you start up.
And someone asked kind of along the same lines, well, first off, how many offices do you cover, Doc?
Right now I'm probably covering about 16 offices. I was up to 18 offices. We kind of restructured a little bit and now I'm covering 16 offices. Aspen actually has even provided me with a car. There's a small payroll deduction of about $150 a month, I think, for this great car that I've gotten. I love it. Thank you. And they pay for gas, they pay for insurance. I just put 4 tires on it, didn't have to pay for it. The only thing I wish they would cover is my speeding tickets. They won't do that. I'm working on it though.
Yeah, that you might be on your own with.
Melissa, let's just touch on that real quick because that's something we implemented last year, and it's something that's really popular. For full-time oral surgeons, we provide them with a company car, and that's anybody that works more than 15 days a month. It is a program that you can go into, like Dr. Chishom chose to go into, but it's just another huge benefit that we provide for our specialists.
Sure.
Yeah.
And if you choose not to participate in that program, you do get a mileage reimbursement if you're using your own personal vehicle. So it will cover, you know, the wear and tear and the gas that you're using for your personal car as well. So it would be your choice.
Now, I also want to mention here, Melissa and Seth, I'm gonna kind of pat myself on the back just a little bit. I have been soliciting Aspen to do something for the assistants for a couple of years. While I really appreciated getting a car, I was more worried about my assistants than I was myself. And so actually just a couple months ago, if your assistant has been working with you for at least 2 years, they are also eligible to get a car. And it brought my girls to tears because it's actually been the first time a couple of them have actually had a new car. And what that does, it does a couple things for you. It ensures that you have dependable assistants that are going to show up to work without their car breaking down, but it also builds some loyalty so that your assistants stay with you. That is a big perk for some of these young ladies. And it's a huge big deal, especially, you know, that's a great perk for working for a company like Aspen. You can't do that in private practice, by the way. It's insurance prohibitive. I tried that in private practice because we had multiple locations and it doesn't work. But working for a corporation like Aspen, they're able to make that happen. It's been a very nice thing to add to my practice.
Yeah, sure, I bet. So again, in no particular order here, just because these questions are coming in hot and I want to make sure we get through as many of them as we can. So we have a kind of a longer question here. Patients that have severe infections post-op, that this patient is saying that this participant is saying that they see these patients a lot of times coming into the ER. And they just want to know, like, how do you handle patients that way? Or are you doing the post-op procedures? Kind of how does that go?
This is where it's very important to have a good established relationship with your general dentists who work in the various clinics that you travel to. And let me say this, as an older guy who's been practicing for a few years, I don't have as many postoperative infections as I did when I first started. You just refine your technique, you learn things, you do things differently, and you just get better at what you do every day. And that doesn't mean to say that, you know, I'm the greatest oral surgeon in the world, because I'm not. But I don't have as many infections. As a matter of fact, in the past 6 years that I've been working with Aspen, I can't, maybe one or two, maybe two or three. Let's say that. Now, for the ones that I did have, what I did was I scheduled a time in my day where I could go back to the clinic that was seeing that patient, or where that patient was seen, and I treated the infection, or I met the patient at another location between he and I, which is an advantage. I can go to any Aspen office and see a patient. And because they're fairly ubiquitous, I'm able to find a place where the patient and I can meet and treat the patient as necessary. Thank God I haven't had to send anybody to an ER or anything like that. I just haven't had that concern, knock on wood. So hopefully that's a trend that continues. But my general dental colleagues, that's not to say, though, that there's some patients who may come back in pain or with concerns, and my general dental colleague in the clinic will see the patient and then call me and say, Mark, you know, I have a patient here who's experiencing XYZ, describe the problem or put me on FaceTime or something along those lines and kind of show me what's going on and ask me, is there something that they can do or what did they recommend, that kind of thing. And so that marriage of colleagues is kind of nice, and they're able to cover me if I can't be there to see the patient personally.
Sure. And a follow-up to that question posed by the same person is, you mentioned that you don't have hospital privileges. This particular person wants to know, was that your choice? Are they, if you work as an oral surgeon for Aspen, can you keep hospital privileges so that you can see some of those patients in the hospital and keep the continuity of care with the patient?
You certainly can. That's certainly your call. If you can find a hospital that doesn't, and good luck with that, because I have rarely seen a hospital that will allow you to have admission privileges that don't want something back from you, i.e. trauma call. So good luck with that. If you can, that's certainly, you know, your prerogative. I've also been able to maintain my boards. And as we all know, ABOMS wants you to maintain hospital privileges, but they also, if you're not maintaining hospital privileges for whatever reason, because you're not able to, you have to have a plan on how to deal with a patient who may need admission. And I have a couple of friends who are oral surgeons in the area that are willing to accept a patient for me on my behalf if I need to refer them for an admission for something I can't handle in the office.
What do you travel with, and how do you manage everything that you have to travel with?
That's a good question. Make no mistake, it's Ringling Brothers and Barnum and Bailey Circus. In other words, you travel from spot to spot, you set up, you tear down. I travel with everything necessary to perform day-to-day oral surgery except for the emergency equipment, which is on premises. Between my assistants and I, we carry everything necessary. We have a system down where we use special luggage on wheels that we pack everything into neatly. We carry a full armamentarium. I can't remember the last time that I needed something and didn't have it. We keep very organized records. We know exactly how much local we have, how much gauze we have, how much drugs we have. And you know, I don't care where you go, what you do, you better be doing that in private practice as well. We travel with our implants. Everything is nice and organized. I have an assistant assigned to certain aspects of my practice that they keep up with and keep inventoried, and we review that you know, every 3 or 4 days just to make sure we're keeping up with that, and we put our orders in a timely fashion so that we're never out of anything. And so I've gotten used to the flow of the practice. My assistants are smart as heck. They know what I need before I need it, and that's hopefully something every one of you will get no matter where you practice. And they'll come to me and say, Dr. Chisholm, it's time to put in an order. We need X, Y, Z, and that's what we do. And we rarely run out of anything.
So again, in no particular order, kind of jumping around a little, we're back to another COVID question. Are you COVID testing your sedation patients, and how are those orders being managed between sites?
Are we, I'm sorry, say again?
Are you COVID testing your sedation patients?
No, I'm not. I don't know who is doing that. I haven't heard of anybody in private practice that's doing that. There's not enough testing, period. And to be able to get a rapid test done like that, it's just not reasonable, right? Especially in Georgia. It's currently taken 10 to 14 days minimally to get a COVID test back. And heck, by the time that you get the test back, who knows if they've been exposed to something in the meantime for that. Sure. What I am doing is every patient comes in, has to fill out a questionnaire. We take the patient's temperature, and we have to go with that. Also, I have there is a study out there that says rinsing with peroxide for, a minimum of 20 seconds prior to any surgical procedure intraorally tends to reduce the amount of the virus. Whether that's true or whether it works, I don't know. I mean, I hocus pocus and say a prayer and let them rinse and hope for the best.
I think that's what everybody's doing, right? Because nobody really knows.
Yeah.
Okay, so we mentioned before about what you carry with you. So we have a question about, do you have autonomy over what instruments you use, what supplies you are allowed to order?
If I didn't at my age, I'd be walking. You cannot teach an old dog new tricks. I've been doing this for 22, 23 years now. If I did not have autonomy, this would not be the place for me. I order what I want, and Aspen has acquiesced to. I can't remember the last time, or if there was a time where they told me no. So I do what I want. I practice how I want. I see the patients that I want. If I don't want to see TMJ, and I don't, I refer those out. It's my practice. And I said this very clearly at the time of my interview. If anybody ever tells me what I can or cannot do from a professional standpoint, I'm going to walk. You can't do that. I work very hard for my license, just like all of you have. And they respect that, and they respect your knowledge. And, Does that mean every day is hunky-dory and perfect in the world of Aspen? No, but there's no perfect day in private practice, and there's no perfect day in military either. There is, let me say this to you, to all of you young guys. I practice almost every way possible now. There is no perfect practice of oral surgery. Everything has its limitations. Everything has its problems. What you have to figure out is what's the best way for you to practice, what works for you, for where you live, how you want to practice, what you want to do, who you want to see. It just has to work for you. And that's, you know, hopefully I'm helping you figure it out from an Aspen standpoint, because it's different. It's a lot different than what I went through in private practice, but it works for me.
Sorry, I'm muted. I got my kids running around outside in the background, so I didn't want any any interruptions. My kids are younger than yours, Doc, so they're a lot louder.
Don't worry, I'm gonna whip my son when I'm finished for walking in the background when we started. Don't worry. He thinks he's bigger than me, but he ain't.
Yeah, but isn't that always the way, right? You ask them for 1 hour, and that's the time that they need to be, you know, kind of running around.
Listen, my bozo is 20 years old. He knew better. He did that on purpose. So we're gonna put a beat down on him when I get off the phone.
No, tell him to join in. Maybe he'll have some insight what it's like to be to live with an Aspen oral surgeon. That could be our next AMA.
Yeah.
So we have a question about the traveling with your equipment. So this person wants to know, are you traveling with instruments and drills? And if so, how is sterilization handled since you're carrying the instruments to different locations?
Yeah, yes, I travel with all of that. And what happens at the end of the day, all of my assistants sterilize all of our equipment, wrap them, and then we store them. And then the next day, all of our instruments are sterile and ready to go. If we notice that any of the packs are damaged or the seal's broken, then we re-sterilize that the next day in the next clinic that we go to make sure everything's ready. I have probably, you know, my assistants could tell you better, 8 to 10 working trays and like 6, 7 drills that I use, and they're all sterilized and ready to go for the next day. So we start up running.
So we're almost wrapping up here. We have about 12 minutes left, and I want to be respectful of everyone's time. So I kind of saved, I don't want to say the best for last, but questions that were coming in about compensation. We had quite a few of them. So I guess we can start with this one. One of our listeners wants to know, what can you actually expect to make your first year on the job?
Okay, well, now let's go through this. Now I'm going to say this, and you're going to love this. My first year out in the military, I'm just going to give you a little background, and then we'll go from there. My first year out in the Army, I made $38,500 a year. Anybody want to take that? I'm sure Aspen will be more than happy to sign you on. I can tell you that that was brutal. But, you know, that was back in the dark ages, I guess. And I came out of the military, went into private practice. My first year out in private practice, I made $185,000 a year. That has moved up a fair amount. Now most residents are, you know, signing on for about $250, somewhere around in there. I can tell you the last oral surgeon I know that started up with Aspen is dusting that. I mean, it's just no comparison. I mean, most of the oral surgeons that work for Aspen do very well. Coming out of private practice, I was in a very good private practice. We were grossing a big number. And if I showed you my tax returns for that year, you would go, are you crazy to be leaving private practice? But that's the power of an unhappy wife, I can tell you. And so that's why we left South Carolina to come to Atlanta. Happy wife, happy life. So I was very worried that coming here, I would, you know, how long would it take me, or if I could ever get back to the same level that I was making in private practice, which was pretty good. I passed what I was making in private practice my second year with Aspen. And I can tell you that's a very good number. You know, well above the average tenured, experienced oral surgeon in private practice. It's above that. Is that going to be the case for every single person that starts with Aspen? No, but most of the guys I talk to at our yearly meetings are doing very well. Money has never been a reason anyone has left Aspen. I just know how hard it is in private practice. I just don't know many guys who are doing those kind of numbers, especially early on coming out of residency. There is no way that you can hit some of these numbers as an associate or buying into a practice for the first 6 or 7 years. I'm thinking of a guy who joined just a couple of years ago in particular, who shadowed me for a while. And I'm not going to give his name or where he is, but he thanks me all the time because he's doing so well. And he never thought in a million years he could even get to that point, you know, in private practice after practicing for a few years. So I doubt very seriously anybody listening would be disappointed with compensation if you get to a busier area with Aspen.
Someone wants to know, what is the farthest office that you travel to, distance-wise?
I have set my limit at 2 hours. I will not go further than 2 hours. Georgia is a big state. And I feel like I need to at least have access to any of my patients that may need me within 2 hours. That's my personal limit. So the furthest I've gone, I don't even go 2 hours now. My longest is probably an hour and a half to hour and 45 minutes from my house.
Oops, I keep forgetting to unmute. How often do you get to work out of 2 rooms?
Say again?
How often do you get to work out of 2 rooms?
Every day.
Labs.
Every day. That's a requirement of mine. I'm very insistent on that. I need 2 closed door rooms that I can practice out of. That allows me, and you know, I don't get a whole lot of pushback on that because that allows me to be very productive. There is no way I could just work out of 1 room and try to turn, for example, I did 10 sedations today before 2, 3 o'clock. You have got to have at least 2 rooms to be able to make that kind of turnover and do it safely. There's no way you can do that out of 1 room. And so I don't get any pushback on that at all. So that's an everyday for me.
Sure. Did you have to go through a state anesthesia site inspection for every office?
Yes. Yes. Per Georgia law. Yep. You have to be inspected.
Okay. I don't know if we're going to get to all of these questions, guys. I'm sorry. How many days a month are you working?
I work 4 days a week, Monday through Thursday. Again, I set my schedule. I control my schedule. I control as, you know, if I want to do, you know, 10 sedations in a day or 4 sedations in a day, that's my call. I chose to work Monday through Thursday and take Fridays off. You know, after doing the Road Warrior thing, I feel like that 3-day weekend allows me to recover. Some guys work all 5 days a week. Some guys do a half day here. It's really, that's something that you come in, you talk with your doctors that you are working with and work with the management in the state and kind of help set your schedule. And you do what is best for your long-term viability and, you know, insanity.
And your mental health, right?
So I know, and your sanity, no doubt.
Who is recovering your patients after sedation if you are doing 10 a day?
Well, I do. You know, what happens is first of all, I don't use fentanyl, guys. I choose not to do that because I don't like the rebound effects that you can get from fentanyl. You guys know about that. I don't need to lecture you about that. My sedation technique is propofol, ketamine if necessary, Versed, I use glycopyrrolate, and I will reverse the benzodiazepine with flumazenil at the end of my procedure. And before I leave the room, the patient is alert and oriented, vital signs are stable, and I require all of my patients, to walk out of the clinic. I don't take anybody out in a wheelchair. Part of my discharge criteria is the patient must ambulate out of the clinic. So before I leave the room, a patient has to meet a certain amount of criteria that I just listed for you. And then my trained assistants who are trained in BLS and ACLS will continue to monitor the patient. And I come back after my next case and make sure that they're doing okay. And then I discharge the patient.
Perfect. Thank you, Doc. I really like this question too, which is why I kind of left it for the end, because I think besides compensation, this is probably something that would be most important to the new residents coming in. What type of support do you feel you receive from Aspen? I know we touched on some of it earlier, but.
Well, what the support I get, which is kind of nice, is if I have a problem, whether it be technical, if, let's say, for example, I'm having a problem with the computer system or the logins or the drug system, we're pretty much paperless, by the way. I pick up the phone and call technical support in Syracuse, and the tech walks me through the solution. That is a great thing. In private practice, you don't have that. You sit on hold forever, and if your computer system is down, if the company that you're using can't come out, guess what? You're down for the day. If something is broken, again, because of the size of this company, the repair people are very attentive to the clinics. They get out there and they get stuff fixed. This past weekend, they just did a great continuing education on implants virtually, which was a really good program. You know, I get a lot of support. I don't have any complaints from where that's from that standpoint. Whatever I need, I pick up the phone and I call, and you know, I've been very happy at the response.
Awesome. Let's see. So we have, so we spoke about, and again, we're kind of running out of time here. We have about 2 or 3 more minutes left. Guys, if I did not get to your questions, I promise you there will be follow-up emails. I can get you in touch with anyone else who can answer your questions. And I do really appreciate the participation. You guys have been awesome. There's more questions than I can handle here. So I guess we'll just wrap up with the big question that someone's asking here is, if you could say the top thing that you love the most about working for Aspen versus other opportunities that you've had in the past, and what would you say you like the least? Let's start with the least, so we'll finish on a high note.
What do I like the least? There are some days I don't like the travel. Some days it would be nice to not have to drive, but I got news for you. Atlanta Oral Surgery, for example, has 22 locations in and around Atlanta, all around the city. If you practice with Atlanta Oral Surgery, you're probably going to have to travel. Most bigger practices, you have to travel. With Aspen, I probably have to travel more than average, but that's part of it. You know, the Bible say, to whom much is given, much is required. You know, I look at my compensation, and, you know, I think to myself, I can do it. You know, I'll go ahead and keep this going because it's worth it. If I wasn't getting paid well, it may not be. And that's the same for any job, right? If you're not getting compensated well, why put up with some of the stresses or headaches of it? But, you know, while it's something that I've gotten used to and it's not as big a deal anymore, you know, sometimes that can be a headache, especially in Atlanta traffic. If you've never been to Atlanta in rush hour, it can be a bear. But there's ways to work around that as well. What do I like the most? I love the fact that I can set my own schedule. My assistants and I get into the office, we start up, we bust it, we get through that schedule. We don't take a lunch, we just work until we're done. And when I'm done, I pack up and I leave. In private practice, I would have to sit around for another hour, 2 hours and do accounting, payroll, retirement plans. There's so much that goes into running a practice or being a part of a practice that I don't have to worry about. I'm done with patient care, I'm out. The accounting and the running, the building, I don't have to worry about it burning down. What am I going to do tomorrow if somebody loots it? My day is done. I walk away and I'm done. On to the next clinic. That is one less headache that is different than when I practice in private practice. Now, there is a little bit, we go to some things that are not the same as private practice. While in private practice, you have 132% autonomy. Every decision is yours. Well, with Aspen, while I have great autonomy, I do have to work with management as they manage employees and building all the stuff that I told you I don't like to have to deal with on a daily basis. I do have to work with the people who do have to deal with that on a daily basis and kind of work with them to make sure that what I'm doing works for the company as well. So there's a little bit more, a little bit more interconnecting that you have to do with non-doctors or the management part of the company that is not involved in private practice, but I have not found that to be overly burdensome.
Okay, so we are wrapping up here. It's a little after 8. I feel like you are just such a wealth of knowledge that we could go on forever, but we've already taken up an hour of your time, and I know a lot of these people that jumped on with us have other things going on as well. So we're going to wrap up here. Seth, thanks for hopping on, even though Dr. Chisholm kind of
Dr. Chisholm's perfect. I
hit it out of the
appreciate it.
park. Yep. And Dr. Chisholm, you are amazing. We thank you so much. I even learned so much sitting here listening to you. So really, I can't thank you enough.
Well, good luck to all the residents out there. I remember those days very well. You got some big decisions to make. Vet them all very well. You can get in touch with any of the Aspen oral surgeons. We'll all be very brutally honest with you. Just know that you've picked a great profession to go into. I wouldn't change it for the world, even though my kids don't like putting their hands in someone's mouth and nobody chose dentistry. But it's been great, and I wish you all the very best no matter what you choose.
Thanks, Doc. Have a great night, everyone.
Thanks, everyone.
Bye.